esdeveniment de la presentació de l'informe de la Bioregió de Catalunya i en aquesta taula rodona, en concret, sobre adopció de tecnologia pel sector salut. Hello, everybody. Welcome to this presentation of the Bioregion report. This is an annual event for the Bioregion. Those who are here on site can see the atmosphere of being all together again. So this is a momentum that we have here today also. And I'd like very much to mention that we will have some panelists, an extraordinary panel of experts, some of them, actually one of them is going to join me on stage. And we have 4 panelists also joining us on site. My name is Montse Davan, and this is actually a travel I want you to join me in through the fast track for adoption of technology on the health sector. So we will travel first across Europe, and we'll have an overview, so a region as vast as Europe and the end as close as Catalonia. And in between, we will travel to Germany, to France, and to UK. And we will see how these countries have introduced new regulations, new mechanisms, new paths to accelerate the adoption of innovation by healthcare system, which is actually one of the things that will help us, for one, reach the patients faster, and with more accurate technologies, and also probably reduce the stress on the EU, European countries' healthcare budgets, which is also one of the great outcomes of these processes. So first of all, I'd like to invite to join me on stage Ramon Maspons. He's the Chief Innovation Officer at the Agency for Health Quality Assessment in Catalonia. He will be speaking at the end of this panel, but he will join me here to listen to our other outstanding guests in this panel. And we will start with an overview of Europe with Richard Charter from Alira Health. Richard Charter is Vice President in Alira Health of Market Access, and he will share with us which are the overviews and probably which are the challenges that the new regulations on medical technologies will put on the entrepreneurs, on the startups, on the SMEs that want to access the markets and the healthcare sector, the public healthcare sector in Europe. So Richard, thank you very much. Alira, I want to mention also that contributed with insights to this report, so we thank you very much for that, for this contribution, for those insights. And where you're ready, the screen is yours. Thank you, Richard.
Thank you very much. I'm hoping everyone can hear me now. So what I'm going to go through here is exactly what mentioned. Now, just as a quick caveat, I have about 10 minutes to get through what could be a full day's presentation. So I may go a little bit quick, but my contact information is on the screen. So please feel free to follow up with me afterwards if you have any questions. Without further ado, why don't we get right into it? So what I want to emphasize first is that there are a number of innovative pathways around Europe for you to consider launching your technology specifically. Now, we've identified through Alira Health, we've identified a number of these pathways, and you can see some of the countries that we've listed here. And I'm going to focus on England, France, and Germany specifically for this one, just to give an overview, and then our other panelists go through into some more depth on each one. But these are very important pathways to consider, because one of the things that is crucial, and this is where Alira Health supports a number of stakeholders, is they all come down to early access pathways that are designed to generate evidence while you're looking at launching your medical technology. So the first thing we need to consider is, why do we need to look at these pathways, and what exactly do they mean for any medtech company that's looking at successfully launching a technique? So I think the first thing to consider, we always guide our companies through this process, and that really is, it's important to understand that your revenue equals price times volume, right? Now, when we look at who the payers are, they are the stakeholders that will often set prices and manage volume of various medical technologies. However, what is often overlooked from many medtech companies is that your revenue is essentially a cost to the payers. And payers very rightfully have to manage this. So what needs to be emphasized is that your access or market access strategy, or whatever you want to call it, really is your pricing and revenue strategy, but it's also a cost management strategy for payers as well. And really, it's the access function that determines which payers are going to, which stakeholders need to be engaged with in order to maximize the communication to be one of them. And we often categorize what we call the 6 Ps of the key stakeholders to engage with payers. First one are the physicians. So those are the doctors who often recommend the technology. It's the provider hospitals, which will actually be implementing and using the technology. It would be the various levels of policymakers. So whether that be local, regional, national, or even at the European level, the procurement teams that have to undertake some kind of an innovative procurement process for innovative technologies. And then, as mentioned in the introduction, we absolutely cannot ignore the patient. Ultimately, it's the patients and the physicians who will be using these medical technologies, and that's really who we're designing, looking to get these successful technologies into the hand for. And all of these wrap around, as I said, with the payer. Now, before we consider any of these early access pathways, there are what I consider to be 5 key questions to be considered to determine if these pathways are in fact needed. Now, the first question, which will determine how easily you can launch your technology, would be, do you have a validated launch cadence? So does your technology have an unmet need in various European countries? So which countries are you going to launch in, and in which order will you launch them? The second one, is there a comparator for your medical technology in each of those markets? If there is a comparator, some of the work will already be completed for you. The third question, are the comparator products used in the same care setting? And we're seeing this as a crucial question as we see more digitally enabled technologies, because the existing comparator to a digital technology may be in a different care setting, because the digital technology is actually looking at moving from maybe the inpatient to the outpatient or even to the home care setting. And that can have a major impact on your market access pathway. Germany is a perfect example of that, where there's a very clear segregation between the inpatient and outpatient reimbursement models. Number 4, is there coding and coverage available for the existing products in that care setting? So again, there might be coding in the inpatient, but not in the outpatient setting. Number 5, does the MedTech company's commercial strategy align with that reimbursement and coverage? Basically, does your price fit within the context of the existing DRG, the existing outpatient code? If the answer to any of these are uncertain, your evidence requirements are going to go up significantly, and that's where we need to start looking at how the clinical and economic evidence is proven and in what order. And that's the 9-step process that we really undertake at Alira Health to determine if an early access pathway really is applicable. The first thing we'll do is determine unmet need and the value proposition for your technology. Then we'll go through and understand the clinical guidelines that are in place for the various technologies. Then we'll go through the process through which you will undertake in order to successfully launch the technology, with the end goal of your innovation essentially becoming the standard of care. This can be a very long process, but it's one that needs to be started off with clear message, clear activity and stakeholder segmentation, and then a clear process. Once we have that mapped out, we can then start looking at some of these accelerated pathways for innovation. So let's talk about Germany for just a moment. We see about 6 innovative pathways in Germany. There's the 137E trial regulation, which is for diagnostic or therapeutic methods that may have potential benefit, but there is not sufficient evidence in order to make a concrete decision. Then there's the 137H trial regulation as well, which really is more for the high-risk devices used exclusively in the inpatient care setting. There's also the very popular NUB process as well, which would be for high-cost medical technologies in the hospital setting when the standard existing DRG is insufficient. There are also selective contracts where you can engage individually with the approximately 100 German sick funds or Krankenkassen in Germany. There's the innovative funds pathway as well, which is a collaboration between payers and hospitals for new forms of care that can improve quality, effectiveness, but still require some kind of economic evidence. And one of the ones that's been getting the most traction and the most interest would be the digital health applications process called the Deager, which really is designed to be a fast-track process to give access to digital technologies. And I'm sure we're going to talk about this later with our German. But these are some of the pathways around Germany, which really allow it to have quite a strong ranking for launching innovation if you identify the correct pathway. Similarly, in France, we see 6 pathways identified here as well. We see the PHRC, which is a hospital clinical research program. It's really designed for medical devices. There's the PRME program, which is more for the economic evaluation or economic evidence generation. Forfait Innovation, which is a crucial one as well. The ETAPS program, which is more for telehealth type of solutions. We see the Article 51, which is an innovation to designed to look at the entire pathway of care. And then the RAHN, which is more for the in vitro diagnostics. And we've done an extensive amount of work across that one, specifically with Alira Health. But when you look at the product lifecycle approach to innovative pathways in Europe, France definitely strongly. And finally, if we look at the UK, we see pathways such as the MedTech funding mandate, rapid uptake of products, which is designed to take NICE approved technologies through the NHS in England. We see the NHS Innovation Accelerator and the Innovation Technology Payment as well. And another one that's been gaining a lot of interest, similar to the program in Germany, is the Artificial Intelligence in Health and Care Award program, which is designed for AI technologies. So with that, we see in England that there are a number of different pathways. The caveat in England is that these are constantly changing, and sometimes it's not quite clear what the entry criteria are for some of these for various technologies. So the ability to launch innovative pathways in England, for example, comes across as slightly more challenging, hence the overall country see there. So with that, I'd like to turn it over to the other speakers. Apologies for going quickly. There was an awful lot of information to disseminate in such a short period of time. But if there are any questions, please feel free to reach out to me via the information on the screen there. And with that, I'll turn it over to our next speaker. Thank you very much.
Overview, actually, of what will probably be explained in more detail also by the other speakers. Let me just mention that Richard has a 15 years experience on financial economics, marketing consulting, etc., and MedTech pricing. So his insights are really expert insights from all of Europe, like he already showed us. And now, after that, I will try to present as the responsibility that Marco will have now, Marco Wendel, to explain the system of reference in Europe, which is the Deager for the fast track in Germany. He will go in more detail to there, but I would like to say that Marco, he's CEO at Medical Valley Digital Health Application Center, where they accompany companies for the fast track to the health market, not only national companies in Germany, but also internationally. And I'm aware that some companies in Catalonia have also followed this path. So probably, I don't know if any of those entrepreneurs are in the room or online. We'd also like to hear their experience on that regard. And definitely, we want to hear about Marco's insights on how Germany has put in place this excellent regulation and the results. So Marco, when you're ready.
Thank you very much. Yeah, it's a pleasure for me to have the possibility to speak to you today. I want to take you a little bit with me to Germany and the Deager fast track. And Richard already sets the scene for Germany and how the situation there for reimbursement and go-to-market is. And I want to just take out one of the different possibilities, the Deager fast track. I want to take you a few years back to the German situation. So Germany spends pretty much in health. So we're a rather rich country spending many money in health care. That's pretty much interesting for the different manufacturers of medical products, but for digital health manufacturers or digital health companies, the situation looks a little bit different. So looking at the digital health index, and that's really reflecting the truth, more or less Germany is really a backbencher in digitalization of healthcare. So it was in the past not a really interesting market for digital health companies because there were just a few possibilities of entering the market. They were long lasting and you could just earn a little money in the German digital healthcare sector, but the market access was not streamlined. This was one of the difficulties Germany faced in really digitalizing the healthcare system. The problem was seen, the problem was solved by the German ministry, and they introduced the Digital Care Act in 2019. The Digital Care Act was seen more or less as a kind of starting point to digitalize the healthcare system, and it regulates many different points for digitalizing the healthcare system. One of it is Deager, so the app on prescription topic I will discuss a little bit more in detail. Others were strengthening the telematics, telehealth, and making data accessible for medical research. The Digital Care Act was more or less a starting point. 4 months later, the Deager regulation was set into force, and 2 months later, applications to the public body BfArM were possible from manufacturers for an intake in the Deager directory. So a rather fast process for German bureaucracy, and 4 months later, the first Deagers were really in the system and could be prescribed. What is a Deager? So that's pretty important to know, of course. So Deager is a medical product of lower risk class 1 or 2A, according to MDR, that has a digital main function, so really an app, a medical app or a web application, and it has a patient-centered approach. So the patient is using it, or the patient together with a doctor. So it's pretty much for just for the outpatient sector, and it can be therapeutic, monitoring, or diagnosis systems. For those that are having a Deager ready application, they can go in this Deager fast track. So a manufacturer applies, the public body BfArM is examining and evaluating the application. In the applications, there are, you have to show the technical requirements on the safety, the functionality, or the quality. So all what is already proven with a CE marking. And some other regulatory issues on data protection, data security, and information safety are coming on top. So that's a bundle of technical aspects you have to show. The other thing is the positive care effect. So showing or having study data on either medical benefits or process and structural improvements, where you can show that the app has an effect. When you can show, on the one hand, the technical requirements and can show good data, you can apply for the direct admission in the Deager directory. So when you get it and BfArM says yes, thumbs up, then you are permanent listed in the Deager directory. That's good, because then you don't have to do anything. If you can just show the technical requirements and don't have the study data necessary, then you can apply for provisional listing. Then you're in the Deager directory for a test phase of 12 months and can make your studies there and showing the positive care effects. And when they are convincing, you are taking up permanently in the Deager directory. If not, you're rejected. Of course, if you can show nothing, so not the technical requirements, not the positive care effects, you will be rejected. So that's a pretty streamlined process in Germany on this Deager topic. Why is it attractive for Deager manufacturers? I mean, it gives access to a target group of 73 million statutory insured people. Of course, not all are falling into every Deager, but you have just to do one contract. So not going to each payer, but you have one contract and your app can be prescribed and the insurance has to pay it. It's rather fast. So after having handed in the complete application, within 3 months, it is decided taking in the Deager directory or not. And what is also nice for many of the manufacturers, you can generate first revenues without having already a study in place. So you just have to make a trend analysis, and when the trend analysis expects good evidence, then you can go into the Deager directory and can be prescribed, and in parallel making your study. What is the status quo so far? Deager is accepted, so in Germany it's around 119 applications. 28 currently are published in the Deager directory. Just 7 have been rejected. A few have 50% have withdrawn and will reapply, and currently 25 are under evaluation. So thinking back the last 15 months, it started with 2, now we are 28, we're expecting to be 50, perhaps in the mid of the year. So yeah, the number of Deagers is steadily growing. Some findings on Deager. I mean, the number of prescriptions currently is around 50,000, so 50,000 Deagers prescribed currently. That's of course not a very high number. For 28 Deagers in total, it's of course okay. It's, I mean, just pure math. When you are thinking about a mean price of 450 euros per prescription, and some Deager manufacturers have 1,000 prescriptions per month, that's, I think, a good revenue for the manufacturers. But for the whole German system, it's of course not a very high number. And this shows also the second number I have brought with the just 0.007% of the SHI budget is spent on Deager so far. So it's currently in the uptake. I think in 2 years when we are discussing again, the acceptance will be, of course, pretty much higher. What we see is that especially where a shortage in Germany in therapy options is giving, Deagers have very good effects and are good accepted, for example, in the physiotherapy sector. When you're thinking about depression, and I don't know how it is in the other countries, in Germany you have to wait until up to 6 months to have a meeting with a therapist. And of course, you can prescribe, get Deager prescribed and can start directly your therapy. And that's, of course, pretty good support for the patients. And there it's really pretty high accepted. What is currently more or less a problem is that the Deagers are not yet more or less deeply integrated in the healthcare system. So the interoperability is not yet so common. That's more or less a problem that the infrastructure is not yet there. So we are currently developing all this necessary infrastructure, that there is also an interconnection with the Deagers. And it is of course just for the outpatient center, for patient-centered applications. And in Germany, we are thinking about currently digital care applications. That is what comes next for care applications. And of course, we are also thinking about more or less digitalizing all the other sectors. So Deager is a good starting point, but it's of course not the thing or the only thing that we want to digitize. A few take-home messages with Deager. We have more or less passed the way for structured market access for patient-centered digital healthcare solutions in Germany. It's really a fast track. Within 3 months, you get a go or no-go decision. You have a collective contract, just one application with one contract, and you get access to the 73 million insured people. The acceptance is steadily growing. It's a kind of test field where we are currently in. It seems to be a rather good go-to-market concept. And Deager is more or less currently a role model for other European healthcare systems. And I'm pretty much interested in what Nina can report on France. So thanks a lot for your attention and your interest.
Thank you, Marco. Thank you very much for this summary of the Deager process, and it was really clear. And you mentioned at the end that this is having a growing acceptance. Actually, this is also the reason why we have the next speaker in this panel, the announcement that the French authorities intended to transpose the Deager procedure to the French market access. So that's why we invited here today Nina Buffy. She is e-health project director at the Ministry of Health in France, but at a specific unit devoted to help the access of digital health innovations to the French public system. So thank you, Nina, for joining us also, and when you're ready, thank you.
Hi, everyone. Oops, I need to unmute myself.
No, you're fine. Nina, are you hearing us?
Okay, yeah, okay. I hear you. I was just making sure. I thought I was still on mute. Okay, sorry about that.
No, it's okay.
Yeah, so thank you for the invitation. I'm super happy to be able to present what we want to do as transposing the German Deager to the French market. So just to give you a little bit of background, we are currently building the house of how to collect data and how to make all data accessible and how to really transform the French healthcare system so that it's all digitalized. And what we are doing as transposing the Deager fast track is actually a part of something larger, which is really the big transformation of our healthcare system, which is up until today not really digitalized. So we have a roadmap, and we're running until the end of this roadmap, where we launched the technical doctrine, and we basically opened the creation of telehealth. And we are now launching actually this week what we call My Health Space, which will be a central place where all patients will have access to their data patient monitoring repository, also all the health appointment and the recordings of these health appointments, personal information, and access also to digital apps. And why I'm saying that is because all of the Deager, like the apps, the digital apps that will be accepted to the French market would have the opportunity to be referenced, to be listed on that platform, basically, that will automatically reach out to all French citizens. So we are running this and launching it this year, or this week actually, and this is the goal. We hope to reach by the end of 2023 a full coverage of the entire population. So that's what we do for the basics in order to give access to healthcare, digital healthcare, to all citizens. And then at the back end, the team that I belong to are working on a full-size program. 650 million euros are spent in order to prepare the ecosystem for innovations. And so to do that, we have split this money into different stages of innovation. In order to do so, we did a call in 2021 to identify the precursive projects that could benefit from that, and we did identify 5 aspects that needed to be funded. The first being education, because if you don't have education of the healthcare professionals, then how can you have adoption of the system, of the digital apps themselves? So we do have some subsequent funding that is dedicated to that. Then research is the next step, to provide really cutting edge science, so to be incorporated in these digital apps. Then we also have building and validation subsidies, basically helping the startups, the newly startups, to be financed so that they can reach the market. And then we do have scale opportunities to be subsidized as well. For for training, we aim to have more than 2,000 healthcare professionals that will train in 36 universities, and we actually just launched the rebuild and the rewriting of all healthcare professionals programs, so that the new nurses, the new doctors, the new physiotherapists are all trained into how to incorporate digital health into their daily practice. In terms of research, we do fund research to anticipate the emergence of disruptive technologies within the 5 years frame, so that we obtain major scientific advances. And then when it comes to the creation of the startups, we do have, for example, a 50 million program that supports the new uses of digital health, so that we can identify new usages of digital health and make that market really sprout. And then what will most interest probably the audience of this conference today is the fact that we have a large pocket of money that is dedicated to support clinical trials and evidence generation of digital health, including innovating clinical studies, so that those can be proven to be efficient and working in all settings. And then we also have what we are talking about today, which is the fast track, which is more a regular. It's not a subsidy program. It's more a regulation type of activity. So that's in a nutshell what we plan on doing. And if we want to zoom today, because that's what you're interested in on our fast track, it's currently in the making. So the law has been passed on Christmas Eve, actually, and we are currently writing the act. So there's not too much that I can disclose, because those negotiations are still confidential. But what I can tell you is that it's going to be targeting products that are already CE marked, for digital therapeutics with clinical evidence, but also including telemonitoring. There will be a strong requirement on data interoperability and also safety. And this would be, just like in Germany, a 1-year fast track access to reimbursement, where applicants would have 1 year to apply for the normal route, after which there would be a case-by-case negotiation. And the price will be fixed initially, so that's the content of the negotiations that are running currently, to fix these prices for the first year. So if you run a comparison between, and that's under your control, Mark, what I understood of the French, of the German Deager and our compared to our French fast track, we do open it to all classes of devices. It's not limited to 1 and 2A. Also, one thing interesting in this measure is that we are also targeting how healthcare professionals are going to be paid in order to prescribe or perform the actions that are related to telemonitoring or the prescription of a DIGA. We do include in our fast track the devices that have an organizational impact and not only clinical impact on the patient. We do not, just like Germany, include devices that are targeting collective use. We only include devices that are patient-centered. And as I mentioned, there will be a framework for the price for the first year, and then a fixed price, except for telemonitoring, which will be frameworked as well. And then prevention is also eligible. So this gives a little diagram here where you see that our perimeter is a bit wider, which also means that we may take a little longer to launch it, because there are many discussions associated to each cases. And we hope to launch the portal by July 1st, 2022, so this year. Thank you.
for this explanation. That's amazing program and how you plan to do all the different steps. And we will be definitely looking forward to this opening of the portal that you mentioned, and also as a reference for a program, and we will discuss later with Ramon as well, both models for Catalonia and what we have already going on here at the same time. So, and asking what's happening in other countries around us, we move now to the UK, and we have a representative from the UCL Partners. This is, she is Deputy Director, Commercial and Innovation in this organization that supports also the access of innovation from the NHS to the market. And she is Suzanne Ali Hassan, and thank you for joining us. And now the floor is yours, the screen is yours when you're ready. Thank you, Susie.
Many thanks. Thank you for having me. I'm glad to be here today. I'm going to talk to you a little bit about evidence and how we support innovations and innovators from across the world to sort of gain access into the UK and work with the NHS. So we recognise the National Health Service is a very attractive market for lots of companies, and we really also recognise, however, that it can be quite complex. And we want to make it really easier for international companies to understand some of the challenges and barriers to adoption and uptake into the system, and provide a bit of advice and guidance really on evidence that really will help them in their journey. Sort of with brands like NICE associated with uptake of technology, it does come down to evidence basically, and technology companies will be expected to prove how they add value to what is a public health system, how they'll save money, and how they'll improve efficiency in the system. So the UK as a whole it is structured really to run across the innovation pathway, right from the academic centres through invention, evaluation, clinical trials, adoption, and hopefully spread within the system to benefit as many patients as possible. And there are various organisations, this is not finite, that support on that journey. And some may be aware that the NHS has different bodies based on some of the devolved nations. So NHS England, for example, provides clinical care in England. NHS Wales will provide the NHS services in Wales, etc. We have, of course, regulatory bodies and NICE that really support that guidance. And here are some funders that also support that journey. But what I'll talk about today is more where we sit, and so the organisation that I sit within at UCL Partners really focused on adoption and spread, which I think a lot of the audience may be interested in today. The Academic Health Science Network is an organisation dedicated to this function, and we are networked across the country. So we are a network of networks, so to speak. And we were set up to really respond to local need, recognising that there is differences across England. We're a small country, but there are still disparities and differences across the population. We are funded by NHS England, and I think Richard mentioned earlier some of the national products programme that we support, so the MedTech mandated funding and the rapid uptake products. Those are fantastic acceleration programs and would be very attractive for companies perhaps in the audience to get onto a program where we are in fact as AHSNs expected to support that adoption and help our hospitals buy those products. It's quite attractive, it's quite competitive, and you have to have a very sort of strong evidence base and NICE approval to get onto them, but it's certainly something for companies to be aware of. We're also funded by the Office for Life Sciences, which sits within the Department for Business, Innovation and Industrial Strategy, where we want to improve health, drive down costs, and also support economic growth. So there's lots of ways where we want to support innovators along their journey, UK companies as well, grow, get better, and work well with the system. So I'll just touch on our geography quickly. UCL Partners covers sort of parts of northeast London and beyond borders into more rural areas. We're a membership of 20 hospitals, many clinical commissioning groups, other big complex structures of the NHS, universities, and we cover a population of 6.2 million people. However, and this is where we talk a little bit around the evidence needed, NHS in England or in the devolved nations is not one organisation, which is often considered and thought of maybe when companies approach the UK. We are made up in total of 223 hospitals, 42 ICSs, or sort of that's population-based systems, nearly 7,000 GP practices, 54 mental health trusts, etc., etc. So although it would be lovely if we all did the same thing and worked the same way, unfortunately we don't. But that's why the AHSNs as organisations are there to support companies better understand the local geography, the local population, and what these organisations need. And this is why, so you'll see this is from the UK Health Atlas, and these are different disease areas: skin cancer, heart disease, liver cancer, and COPD. And you can see the huge variation from the north of England versus parts of the south, more affluent areas versus more underprivileged areas. So there is variation in need in the system, and that's both clinically, as you can see here, but also in terms of the operational need and the resources available to them, and of course financially as well. So I suppose I'd say innovators working in particular therapeutic areas do consider this, do explore where the need in the market is truly is going to be truly attractive for your innovation and where you might want to focus. And it just brings me back on to how we as commercial and innovation teams support companies like yourself. So we help locally in our region advise commercial partners on how to work best with that local system. We bring them together. We were set up to bridge the gap between commercially available technology and the NHS, because there was a real lack of need within the system. So that's broadly how we might work across the network. And we really advise company around these main principles, which I think Richard also mentioned earlier as well. Where is the need? Is it desirable in the system? And we do a bit of work to better understand the pull from the system. We work on behalf of our NHS partners, and that comes down to that variation in clinical need as well. We do a lot of work to develop value proposition with the companies. Who are you selling to? Who's buying the product? Where is the value going to be added to the system? It's sometimes upstream and downstream of the pathway that you're going to be impacting. We also look at budget impact modelling. So where a health economics case is fantastic and it's really helpful, sometimes looking more at an individual NHS provider's budget and how it might impact. So using that health economic data to really develop something useful for providers so they know what they're buying. And also real world evidence and validation, where if we support you engage with one of our local sites, you have a pilot site, how do you make sure that the work you're doing doesn't go to waste? And in fact, that you're gathering evidence to show how those benefits are realized in the real world. How does it impact the workforce? How does it impact the doctor and nurse's time? How does it affect the user, the patient, etc.? And capture those kind of more qualitative benefits that are sometimes missed by the more sort of quantitative analysis through the budget impact model. And that's what I wanted to talk about in terms of adoption and spread and uptake. But I also just wanted to mention that we are quite a complex organisation as UCL partners anyway. And I think the companies are at a slightly earlier stage of their journey and are interested in access to research opportunities, partnerships that can build their evidence base a little bit before they've launched onto the market. We have lots of supporting organisations that can help to do that. A fantastic initiative called Data Can, which aligns cancer data sets across the country, and that's open for industry, researchers and clinicians to use for the purposes of development of new technology, new medicines and new diagnostics. We've also got 2 accelerator programs that are linked to UCL partners. Again, Richard mentioned the NHS Innovation Accelerator, which is actually hosted at UCL partners. Brilliant national program to be involved with, open to international companies that have something good, although it has to be evidenced also in the NHS already. And the Digital Health London Accelerator, which is a pan-London program, and again provides really great support to companies wanting to look into the system as well. So just to say finally, it can be complex, the NHS, but it is worthwhile. And I'd say consider your market entry a staged process. build your evidence, and then consider selling. Don't try, well, you can do them in parallel, but don't try and assume you can do one before the other. If you are early in your journey, do consider your clinical validation studies as part of your UK market access strategy. It really helps to have that UK clinical site involved in sort of evaluating your product. Understand the NHS care pathway, it's essential, and we can help you do that. That's what our organisations are for. And the NHS network broadly can support and advise your approach. So although we're based in London, we've got fantastic colleagues across England and brilliant hospitals and capabilities across the country. So do have a look at the HSN network as an organisation. And here's some details. This is UCL Partners website. And if you want to get in touch and see how we might want to support your company, you can email us at commercialteam@uclpartners.com. Thank you very much, and happy to maybe answer some questions later.
Yeah, thank you, Susie, for this also overview of what's going on at that regard in the UK. And this is all of you. The 4 presentations have been of extreme value to all of us here and to the next speaker as well, because and that's why we thank you very much for joining us today and giving all that insight and this value to our panel. And please stay here for questions after Ramon. We probably don't have a lot of time for questions, but probably we'll pick a couple of them. And now we move to Catalonia, to the vision that Ramon Maspons, the chief, like I said, the Chief Innovation Officer in the Agency for Quality Health Evaluation in Catalonia, will give us, and I'm sure he will refer, in the title it says so, to 5 keywords. And I guess I can just imagine a couple of them: patient, reimbursement. So the floor is yours to continue. And now the floor is through.
Okay, thank you, Monse. Finally, it won't be 5 words, it will be 7 words, unfortunately. So I write the vision related with value-based schemes. So to be the last speaker, it gives me some possibilities for not repeating some ideas from my colleagues, but to go one step beyond on some of the new ideas. I'm not talking anymore about traditional fast tracks in order to adopt innovation in Catalan healthcare systems, but I will give you an overview of the main remarks, the main commitments that at Catalan Ministry of Health we are taking care in order to set up these new fast track models for adopting innovation. First of all, let me share with you the idea that payer and healthcare provider nowadays are facing a new paradigm. This new paradigm needs the possibility that new schemes that are based on new dialectics are used. This new dialectics is not anymore based on product price evidence scheme, to a new scheme based on needs, solution, and value. This new scheme based on needs, solution, and value, it clearly addresses payers and healthcare providers to at least 4 new situations to take care in this fast track model. First, related with servitization. Servitization, it means turn product into service. Second, related with personalization. Third, related with prevention. And the final one related with sustainability. So these new dialectics, needs, solution, and value, it's giving us the possibility to design a new framework. Second issue related with new framework is the situation that unfortunately never before so much innovation in the funnel of companies, but at the time, never before so little money for adopting innovation. And unfortunately, this situation won't change in the next years for healthcare sector. Third idea for taking care of this new framework is that all this new approach couldn't be a mood. We have to systematize all this new approach in order to repeat, in order to adopt as a general trend in healthcare sector, at least in Catalonia. So it's nice to do, but we have to move from the nice to do to need to have in order to address, to face this new paradigm. And finally, not 5, 7 keywords. First, related with strategy. What strategy does the procurement strategy support? Financial one, cost reductions, innovation strategy. From our point of view, from Catalan Ministry of Health view, our procurement strategy supports health strategy. It means improving patient outcomes, improving health outcomes. So our procurement strategy, our adoption of innovation strategy has to give us, health providers, payers, the possibility to improve patient outcomes, healthcare system outcomes. Second idea, second keyword, innovation. It means incremental innovation, but also it means radical innovation, transformative innovation. It's not anymore about doing efficiently wrong things. It's about doing right things. And it's about how we are adopting exponential technologies and how exponential technologies will impact healthcare sector. Patient-centered analytics, of course, data liquidity, not anymore interoperability, data liquidity, it means availability of information, it means information flows throughout healthcare systems, evaluation, not only evidence, but evaluation, and it means real-world evidence, but at the time, real-time evaluation, and sometimes giving the right patterns in order to set up evidence, not always exists evidence, and finally reimbursement, from fee-for-service to DRG, to bundle payments, or to value-based payment. Taking care of this situation, of this general framework, we are facing the situation that healthcare system is expanding. It means that we have to design this new fast track, taking care that buyers are sophistication their activity. And companies have to take care of this situation. This buyer sophistication, of course, I agree that it's clear, a factor for increasing competitiveness of our ecosystem. Absolutely clear at this point. Buyer sophistication is directly related with competitiveness of healthcare systems. But at the time, it means different approach. Biocat, Catalan Ministry of Health, and other partners in Catalan healthcare systems and in Catalan ecosystems, we are working together in order to set up this new fast-track model, in order to take care of these 5 elements. First of all, new agents, new companies coming from other sectors are providing us new solutions. Please don't think anymore in Google, Apple, or big companies, big tech. We are thinking in startups coming from RegTech, InsurTech, FinTech, whatever the tech sector. We need solutions. We are facing new challenges, so needs, solution, value. Second, new business models. Current business models will radically change in the next 5 years. InsurTechs, RegTechs will provide us with new business models based on coupling and uncoupling activities related with logistics, related with detail, as has been happening in other sectors. So take care of this point, new business models. Of course, new funding tools, new reimbursement models. So take care of this point, and this will be one of the critical points, the reimbursement scheme, dissemination models, and new knowledge. Knowledge is coming from all other sectors than healthcare sectors. In order to take care of the main 5 issues that we are taking care in this new fast-track model, first of all, patient-driven, based on real needs. So we will focus on this kind of solution, and our fast track will focus on real needs, patient-centered and real needs. Second, better quality services and patient satisfaction. Of course, all of this is related with value. When we are talking about value, in the end, we are talking about 4 factors. First one, related with improving patient outcomes. Second one, related with reduction of consumption of healthcare services. Third one, related with improving productivity. And the last one, related with sustainability. Third point, related with our new procurement schemes, the idea of solving problems in a co-creation scheme with companies. So this idea of not being anymore customer providers, but being value partnerships. 4 points related with the possibility to use these innovations for the redesigning of healthcare services in a clearly user-centric model. And finally, the possibility to use all of these alternative ways, alternative instruments, in order to fund and to strong and to foster prevention activities. So our general approach, just for ending this presentation, this idea of value partnerships. Please, companies, take care of that. We need clear value proposition. What value companies are providing healthcare providers and payers? But at the time, we will be extremely clear in the value that we are going to provide to companies in order to have these fast tracks, in order to scale up. And finally, how we will work together in order to connect companies' value proposal with healthcare providers and payers' value proposal. Thank you.
Thank you. Perfect, Ramon. Thank you. Also for being on time. We apologize, we only have time for one question. And yes, Angeles? Hi. And sorry about that, because really we are running out of time.
Hello, this is Angeles Barrios. I'm director for, can you hear me? No? Okay, maybe. It's Angeles Barrios, the director for public affairs at EIT Health Spain. Thank you to all the panelists for the excellent presentation, and to Biocat for taking the lead on this important, relevant topic. We think we need more awareness on this at EIT Health. In fact, we are creating a series of roundtable discussions with all the stakeholders in the value chain in order to progress and take this topic forward with the participation of all the agents in healthcare in Spain as well. On next week, we will have another roundtable on this. I would like to make a question to the panel. What are your opinion, or what are your views about potential harmonization of this regulation within Europe? And what would you think are the benefits? Are we at that point of the topic? Thank you.
Okay, thank you. This is a question for all the panel, and we just can gather one answer because of that. But please, who wants to answer this question from Angeles, from EIT Health?
Hi there, it's Richard Trevor. I'll jump in because it's kind of an overarching question, not for one specific country. I think, to me, having unified regulation it can be very tempting in theory, very difficult to implement in practice, because there are very local nuances that need to be considered. We see this, for example, through the HTA regulation. where they're looking at harmonizing the same HTA legislation across each of the member states in the European Union. But as the costs and interventions differ significantly within specific countries, it can be very difficult to standardize things. That said, I really like what both Marco and Nina presented with respect to taking best learnings and best practices from other countries and supporting the infrastructure for innovative reimbursement methods in a neighboring country, because that gives consistency and predictability, which I think is a very good thing for innovation in Europe. So thanks.
Well, thank you, Richard, for the answer. And just to recall that we have also questions online, but we will try to gather them all and just give the proper answers, and we will also send you the questions when they're directed to any of the panelists of today's session. So thank you very much, everybody on site and online, and thank you the panelists for your generous contribution to this event of the Bioregion of Catalonia. Thank you very much.